Knowledge assessment for the private rotorcraft. Section Human Factors. Eye movements during daytime collision avoidance scanning should not exceed 10 degrees and view each sector at least 1 second. A pilot experiencing the effects of hyperventilation should be able to restore the proper carbon dioxide level in the body by slowing the breathing rate, breathing into a paper bag, or talking aloud. The technique the pilot should use to scan for traffic to the right and left during straight and level flight is systematically focus on different segments of the sky for short intervals. When a stressful situation is encountered in flight, an abnormal increase in the volume of air breathed in and out can cause a condition known as hyperventilation. The most effective method of scanning for other aircraft for collision avoidance during nighttime hours is to use peripheral vision by scanning small sectors and utilizing off-center viewing. Checklists is one of the neglected items when a pilot relies on short and long-term memory for repetitive tasks. Large accumulations of carbon monoxide in the human body result in loss of muscular power. Human error is the one common factor which affects most preventable accidents. "I am not helpless" is an anecdotal phrase that can help reverse the hazardous attitude of resignation. Hazardous attitudes occur to every pilot to some degree at some time. What are some of these hazardous attitudes? Anti-authority, impulsivity, macho, resignation, and invulnerability. A lack of orientation with regard to the position, attitude, or movement of the aircraft in space is defined as spatial disorientation. Hypoxia, a state of oxygen deficiency in the body. Emotional tension, anxiety, or fear would most likely result in hyperventilation. What effect does haze have on the ability to see traffic or terrain features during flight? All traffic or terrain features appear to be farther away than their actual distance. The best method to use when looking for other traffic at night is to look to the side of the object and scan slowly. Prior to starting each maneuver, pilots should visually scan the entire area for collision avoidance. The pilot is responsible for determining whether a pilot is fit to fly for a particular flight, even though he or she holds a current medical certificate. The anecdotal phrase, "it could happen to me," can help reverse the hazardous attitudes of invulnerability. If a pilot experiences spatial disorientation during flight in a restricted visibility condition, the best way to overcome the effect is to rely upon the aircraft instrument indication. A pilot and 2 passengers landed on a 2,100-foot east-west gravel strip with an elevation of 1,800 feet. The temperature is warmer than expected, and after computing the density altitude, it is determined the takeoff distance over a 50-foot obstacle is 1,980 feet. The airplane is 75 pounds under gross weight. The best choice is to wait until the temperature decreases and recalculate the takeoff performance. The anecdotal phrase, "not so fast, think first," can help reverse the hazardous attitude of impulsivity. Susceptibility to carbon monoxide poisoning increases as altitude increases. When operating an aircraft at cabin pressure altitudes above 12,500 feet MSL up to including 14,000 feet MSL, supplemental oxygen should be used during that flight time in excess of 30 minutes at those altitudes. The anecdotal phrase, "taking chances is foolish," can help reverse the hazardous attitude of macho. Scan slowly to permit off-center viewing is the most effective way to use the eyes during night flight. Scud running is when a pilot pushes his or her capabilities and the aircraft's limits by trying to maintain visual contact with terrain in low visibility and ceiling. In the aeronautical decision-making process, recognizing hazardous thoughts is the first step in neutralizing a hazardous attitude. Pilots are more subject to spatial disorientation if visual cues are taken away, as they are in instrument meteorological conditions, IMC. Most mid-air collision accidents occur during clear days. Unless each occupant is provided with supplemental oxygen, no person may operate a civil aircraft of U.S. registry above a maximum cabin pressure altitude of 15,000 feet MSL. A pilot should avoid bright white lights at least 30 minutes before the flight. The danger of spatial disorientation during flight in poor visual conditions may be reduced by having faith in the instruments rather than taking chances on the sensory organs. The anecdotal phrase, "follow the rules," can help reverse the hazardous attitude of anti-authority. Risk management as part of the aeronautical decision-making, or ADM, process relies on situational awareness, problem recognition, and good judgment to reduce the risks associated with each flight. Continual flight in instrument conditions often leads to spatial disorientation or collision with ground obstacles when flying under visual flight rules, or VFR. You can determine if another aircraft is on a collision course with your aircraft because there will be no apparent relative motion between your aircraft and the other aircraft.